Hello everybody and welcome to PathoLogic. Today we're going to be discussing diabetes mellitus in veterinary species. Diabetes mellitus is a disorder of glucose metabolism due to either insulin deficiency or insulin resistance. The end result in both cases is chronic hyperglycemia. This condition primarily affects middle-aged and older dogs and cats of our veterinary species. As mentioned, the hyperglycemia can occur from one of two main factors. The first is failure to synthesize or release adequate insulin in response to glucose stimulation. We refer to this as type 1 diabetes. You can also get hyperglycemia from reduced sensitivity of the tissues to insulin, which we call type 2 diabetes. Hyperglycemia can also occur from other conditions, such as antagonization of insulin by drugs or hormones, or primary disease of the pancreas. We refer to these types of diabetes as type S. The major clinical signs of diabetes are polyuria and polydipsia, and polyphagia with weight loss. You will also often see weakness and lethargy. On diagnostics, you can see persistent hyperglycemia even after fasting, glucosuria, and elevated serum fructosamine. We will start by discussing the normal glycemic response. Under normal circumstances, glucose in the bloodstream stimulates the pancreas. The pancreas then releases insulin into the bloodstream. Insulin binds to cells and stimulates glucose uptake into those cells, so they can use glucose as an energy source. Now we will look at what happens in type 1 diabetes. Type 1 diabetes is caused by immune-mediated or idiopathic loss of pancreatic beta cells. The beta cells are the ones that produce and secrete insulin. Without adequate insulin secretion, the body cannot respond to peaks in blood sugar, resulting in hyperglycemia. This is the most common form of diabetes in dogs. So in type 1 diabetes, the pancreas does not release insulin in response to hyperglycemia. Therefore, the cells are not stimulated to take up glucose, resulting in glucose staying within the bloodstream. Now we'll look at the glycemic response in type 2 diabetes in comparison. Type 2 diabetes is multifactorial in origin, but ultimately results from the failure of tissues to bind to insulin despite there being adequate insulin levels. We refer to this as insulin resistance. There can also be a component of decreased insulin secretion in this condition. This is the most common form of diabetes that we see in cats. In the type 2 diabetic response, adequate insulin is released, but it does not bind to the cells. Therefore, glucose is not taken up by the cells and it remains in the bloodstream, causing the hyperglycemia. Now that we understand how diabetes occurs, we can look at some of the consequences of diabetes that occur elsewhere in the body. In the fat cells, diabetes triggers lipolysis, or fat breakdown. This is because the cells are not using glucose to produce energy, so they need an alternative energy source. The increased fatty acids in the bloodstream from breaking down fat can act as that alternative energy source for those cells. In the muscle, we often see muscle wasting associated with diabetes. This is also due to cells requiring an alternative energy source. In this case, the skeletal muscle provides proteins that the cells can use for energy production. There are a couple of significant consequences of diabetes in the liver. First, we would expect that gluconeogenesis, or the formation of new glucose, would slow down in the face of hyperglycemia. However, the liver cells can actually become insulin resistant too, so therefore they do not respond to the high levels of insulin and glucose in the bloodstream. They instead just keep producing glucose, which then worsens the hyperglycemia that's already occurring. Second, the elevated fatty acid levels from the breakdown of fat can also cause problems for the liver. The high levels of fatty acids overwhelm the liver's ability to process them, resulting in lipotoxicity or fat toxicity. This results in hepatic lipidosis, which we also call a fatty liver. There are also changes that we can see in the pancreas. Hyperglycemia is actually toxic to beta cells, which then further reduces insulin secretion capacity of the pancreas. Furthermore, the fatty acids from fat breakdown can also be toxic to beta cells. The combined effect of these two toxicities means that diabetes worsens if left unmanaged due to more and more death of the beta cells. Finally, we have the kidneys. The kidneys are going to filter any excess glucose in the bloodstream into the urine for excretion. However, because glucose in the urine is osmotic, it actually pulls fluid towards it. In this case, that means that extra fluid is going to end up producing a larger volume of urine. This is why diabetic patients typically have polyuria. The increased loss of fluid in the urine also results in dehydration, leading to the polydipsia that we also consider to be characteristic of diabetes patients. We will just summarize the consequences of diabetes quickly before moving on to some different syndromes associated with diabetes. To start, cells need a new energy source to replace the glucose that they can no longer access. The two main alternative sources are fatty acids from fat or protein from the skeletal muscle. This can lead to hypertriglyceridemia or muscle wasting. In the liver, gluconeogenesis does not stop, which worsens the hyperglycemia. Additionally, the hypertriglyceridemia can cause hepatic lipidosis. Finally, the combined effect of high fatty acids and high glucose is toxic to the pancreatic beta cells, which further reduces insulin secretion. Now we will discuss some specific syndromes that are associated with diabetes. We will start with diabetic ketoacidosis. Ketoacidosis is a combination of ketosis and acidosis. This is a serious, life-threatening complication of unmanaged diabetes. It is often associated with concurrent underlying disease such as pancreatitis, hyperadrenocorticism, or bacterial infections. This is likely due to stress from those concurrent diseases, increasing cortisol release, which has a lipolytic effect and thus worsens the lipolysis that's already occurring from the diabetes. Once again, those elevated fatty acids from lipolysis are going to cause lipotoxicity in the liver. Lipotoxicosis prevents adequate processing of fatty acids. Once the liver becomes overwhelmed, it instead uses pathways that produce ketones and hydrogen ions. Releasing these products results in ketosis, or high blood ketones, and metabolic acidosis due to the elevated hydrogen ions. Clinical signs of diabetic ketoacidosis include dehydration, vomiting, tachypnea, a ketone odor to the breath, and stupor or coma. On diagnostics, we can see a metabolic acidosis with a high anion gap, since ketones are going to contribute to the anion gap. We also see ketonuria due to filtration of excess ketones into the urine. Finally, we have the classic hyperglycemia and glucoseuria from the diabetes. Next, we will look at hyperosmolar hyperglycemic state. This is another serious, life-threatening complication of unmanaged diabetes. It is less common than diabetic ketoacidosis. This condition results in hyperosmolarity of the blood or higher levels of solutes relative to the tissues. It is typically associated with concurrent underlying disease or reduced water intake in diabetic patients. Under normal conditions, hyperglycemia is diluted out in the blood volume. As the patient becomes polyuric, they end up becoming dehydrated due to fluid loss. This reduces their blood volume and therefore increases the osmolarity, the relative concentration of solutes. If the patient does not correct this imbalance by drinking water, it starts to get worse. The lower blood volume reduces filtration in the kidneys, leading to further retention of glucose and urea instead of excretion. Retaining these products makes the osmolarity of the blood even higher. To try and dilute the osmolarity in the bloodstream, fluid is then pulled from the cells. This results in severe tissue dehydration and can ultimately cause cell death or damage. Clinical signs of hyperosmolar hyperglycemic state include dehydration, vomiting, tachycardia, a prolonged capillary refill time, seizures, and stupor or coma. On diagnostics, you will see a severe hyperglycemia as you would expect with diabetes. However, there is mild or no metabolic acidosis, which is what differentiates this condition from diabetic ketoacidosis. You will also see azotemia due to retention of urea in the kidneys. Finally, there will be an elevated blood osmolarity. There is an equation you can use to estimate blood osmolarity using sodium, potassium, blood urea nitrogen, and glucose values. Now we will discuss a few smaller syndromes that are frequently associated with diabetes. The first is cataracts. Normally, glucose in the lens is metabolized for energy. When there is hyperglycemia, that metabolism pathway becomes overwhelmed. To try and cope with that high glucose, the lens ends up using an alternative processing pathway that produces sorbitol. Sorbitol is highly osmotic and it ends up drawing water into the lens fibers, causing them to rupture. This is what we see as diabetic cataracts. Diabetic cataracts are most common in dogs of our veterinary species. Diabetic neuropathy is a condition where hyperglycemia causes glycation of myelin sheaths that are surrounding the nerves. This results in demyelination and potentially damage to the nerve axons themselves. We most commonly see this condition in cats, where it results in a characteristic plantigrade stance in the hind limbs, where the cats start walking on their hocks. This neuropathy is reversible in mild cases if it's treated early. We've already discussed a few changes in the kidney associated with diabetes, but it can also directly impact renal function. Diabetes causes increased glomerular capillary pressure, which can lead to glomerulosclerosis, or scarring of the glomeruli. It also thickens the basement membranes, making it more difficult for the kidneys to filter compounds appropriately. Left unmanaged, diabetes can actually end up with end-stage renal disease. Finally, we have diabetic retinopathy. Hyperglycemia can damage small vessels within the retina. This results in dilation of veins and focal areas of hemorrhage. We most commonly see this condition in dogs with chronic, poorly managed diabetes. To finish up, we will briefly review species differences in diabetes for our 4 main veterinary species. Dogs primarily develop diabetes in old age. It is usually caused by immune-mediated destruction of the islets, or type 1 diabetes. In some cases, pancreatitis can also cause diabetes due to the loss of the pancreatic islets and beta cells from the inflammatory disease. Dogs are particularly prone to developing cataracts as a consequence of diabetes. Diabetes is relatively common in older cats, and it typically results from a decline in beta cell function combined with insulin resistance. This produces a type 2-like syndrome, but it is not directly equivalent to type 2 diabetes that we see in people. Because of this slight difference, cats actually have quite a high rate of diabetic remission, which is quite unique to this species. Between 20 to 40% of cats can enter remission after treatment begins, likely due to recovery of the beta cells, allowing them to resume their function of secreting insulin. Diabetic neuropathy is the most common syndrome that we see associated with diabetes in cats. In cattle, diabetes is most commonly associated with persistent viral infections. In particular, foot and mouth disease and bovine viral diarrhea virus have been known to cause diabetes. This is because these viruses can trigger immune-mediated destruction of beta cells, giving the cattle type 1 diabetes. In horses, equine metabolic syndrome is probably the most equivalent condition to diabetes. This syndrome results from insulin resistance within the tissues. Left untreated, the major consequence is laminitis, or separation of the lamellae within the hooves. This laminitis appears to be triggered by the hyperinsulinemia itself. In summary, type 1 diabetes occurs from failure to secrete insulin due to beta cell damage. This is the type we most commonly see in dogs. Type 2 diabetes occurs from the cells becoming resistant to insulin, preventing glucose uptake. We see this condition in cats. When dealing with diabetic patients, be mindful of the two life-threatening conditions associated with diabetes, which are diabetic ketoacidosis and hyperosmolar hyperglycemic state. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. It really helps the channel grow and reach more vet students. Thanks again for watching, and we will see you in the next video.